Welcome back to Mid Morning. Hospice of Lake Cumberland is providing comfort, support, and dignity during life's most challenging times.
Here to tell us more about what services they offer and how they comfort patients and their families are Alvina Frazier and Amber Smith. Thank you both so much for being here today.
Thank you for having us.
Tell us about the work that you do.
So we service 7 counties in our area, and we go into homes, we go into nursing facilities, we service people in just wherever they need to be serviced. So we provide comfort, we provide pretty much just whatever they need. If they have food securities, we make sure to address those needs also. So just whatever they need, we are there to help them.
And do you all do some things also to kind of help these people celebrate their loved ones, you know?
We do. I'm one of the social workers with hospice, and we always make sure we are remembering birthdays. This could be, a last birthday that families get to celebrate, or anniversaries. We do extra mile projects a lot, and that entails us maybe taking a family on a camping trip for a weekend, and we have had patients that gets to go on to a concert trip or something that they wish that they could do maybe for the last time. We obviously ask our communities to donate, and we have a huge success with donations from our communities that makes these wonderful extra mile projects happen. So it's a great program.
I imagine there are some misconceptions when it comes to hospice care. Can you tell us about some of those?
Yes, lots of people think that we come in and then the patient is going to pass away. Ideally, we like to come in so we can build a rapport with the patient and the family and get to know them and give them the best quality of life that they could have through their disease process. We do lots of education and lots of knowledge. People think that we have medications that can shorten someone's lifespan, and that's just not the truth. The medications we do give, we treat their symptoms. We make them more comfortable. We treat their pain, their shortness of air, anything that's making them uncomfortable, we try to treat that to help them so they can be awake and talk with their families and be comfortable and have the best life of whatever life they have left.
How important is it to have these conversations that can be uncomfortable, but it can really make things better as you get near the end?
It's such an honor, and we try to let the families know that we are so honored that they have let us come into their personal space. I mean, inviting people into your home is a big deal, and we just let them know that just to have the knowledge is so good. What was your question? I don't forgot.
No. It's just how important it is to have these conversations early, because a lot of times people put them off because they may be uncomfortable.
Right.
But it's just it allows
it is
people
really hard
to do that at home.
When you have the people that will open the door to it, and some family members want us or a social worker to talk to them because just knowledge is power. And when we can talk about end of life and things to expect, and like the social workers help with power of attorneys and living wills and things like that. It's just things that some people don't even think about.
Right.
We definitely like to try to get, to be a hospice patient, you have to have a terminal illness and have a 6 months or less life expectancy. But a lot of times we get into homes and we are able to manage their care well enough that they live longer than that 6 months. So if families would be more open and I think accept the education of hospice early on, we can honestly, maybe give them longer than they thought they had with their loved one.
Help people out there. All right, hospicelc.org, place to get more information.
Yes.
Thank you all so much.
Thank
you guys.
Thank you.